Botox is a muscle relaxing injection and it's been used in medicine for a long time, before we were using it in cosmetics. When I started the Harley Street Skin Clinic over 20 years ago with my wife, Leslie, Botox was just coming in to the cosmetic field. It's been used historically for relaxing muscles in babies and children with cerebral palsy and muscle spasticity. It's also been used for relaxing muscles in people who have bruxism, which is teeth grinding, and people who have very tight jaws. And it's been used medically also for treating things like migraine where muscles are involved. So the medical treatments are well known. It's been around a long time, it's a safe drug, and we know that in cosmetic treatments, it's even safer because even smaller doses are being used. When it is used correctly at the right doses, we can get some fantastic results. When we first started, people were aiming at paralyzing the muscles, and we used to see this sort of shiny face with no movement, no expression. That's not how we like to do it. We like to have expression, but to be relaxed and to look younger. Hi, my name is Dr. Aamer Khan. I'm a medical doctor and have been qualified for over 40 years now and have had 20 years experience in the National Health Service, in integrative medicine and general practice and aesthetic medicine. Over the last 20 years, we've developed our cosmetic and aesthetic clinic in the private sector, and we offer a whole range of treatments. Our expertise as a multidisciplinary team of experts ranges from dermatology, skincare, all the way through to surgical procedures. We embrace some of the most modern techniques, but all our procedures are evidence-based, and we look at our outcomes to ensure that we're doing the right treatments for the right people. What's too young to have Botox? Well, there isn't an age that's too young or too old to have Botox. The important thing to realize is what we have to do is assess the patient at their point of need. If people have very active muscles, very strong muscles, which are causing an imbalance in their features, then it would be appropriate to give Botox. And we've noticed over the last 20 years or so that younger people, because they sit in front of a computer, they're screwing their faces up a lot more, that the need for Botox is becoming younger and younger. Younger people use Botox as a preventative treatment, and older people use it to reverse the signs of aging. So the important thing here is, and the most important message is, to go and see somebody, talk to them about it, and together decide whether or not Botox is the right treatment for you. Some people are concerned that if they have Botox too early, that it's going to have a long-term negative effect on the development of the face. With expression muscles, that isn't the case, as long as we don't paralyze the muscles. If we paralyze the muscles, then the muscles forget how to work, and they will then thin out and atrophy. Then you'll get weakness in those muscles. However, if we're relaxing the muscles to a more youthful position and the muscles are still expressing, then that tends not to happen. What we do is we keep a more youthful appearance of the skin, because overactivity of the muscles can cause long-term deep lines and wrinkles in the skin. Indication for Botox cosmetically under 20 years of age is unusual. We are seeing more and more people with facial asymmetry, facial imbalances, and we can help to balance the face out if the muscles are involved. However, it's important to consider other treatments at that sort of age, things like collagen banking, skincare, preservation, and the whole concept of what we call prejuvenation is coming into its own now, where people are coming in for healthy skin, prevention of the aging process, and also collagen banking, which increases collagen and helps them to retain a youthful appearance for longer as they start to age. I'm starting to see patients at 18 and 19 for Botox now. And the question is that too early? Now that really depends on the assessment. So what I would suggest is, if you are very young and you're struggling with the concept of whether you need Botox or not, please make an appointment. We will guide you through it, and we will help you to make the right decision for you.